Hey everybody, Dr. Healy from Root Healing Wellness here. And today we're going to talk about menstruation. And I know you're asking, what does a man know about menstruation? Well, I have worked with literally 10,000 plus women who have had menstrual complications. And I want to discuss with you, what does a normal period look like? What are the complications? And what are some possible solutions? So a normal period should be on a regular cycle, about like 28 days. When you bleed, there's normally about like 4 to 5 days of bleeding, okay? And the color of blood should be what we call a normal red. The amount of blood should be what we consider a normal amount, not too much, not too little. You shouldn't have clotting, and you shouldn't really suffer from PMS. And I know you're thinking, what does that mean? No PMS? No cramping? No mood changes? Yes, it is possible. Just because a lot of your girlfriends around you are suffering in that way doesn't mean that that's normal. It just means that it's common. Okay, so now we kind of know what a normal period should look like. So what kinds of irregularities do women face? You can have irregular menstruation where it's not on a 28-day cycle. You can have amenorrhea where you're not even getting your period. The amount of time that you bleed could be too short. Oftentimes there's some anemia there, definitely hormonal issues. Sometimes too long. Oftentimes when it's too long, that the color of blood might be on the darker side. There might be clotting. There might be some heaviness in that bleeding. Could be things like endometriosis, PCOS, many other possible diagnoses. The color of blood could be too light, or again, towards the iron deficiency. Could be too dark, more stagnation, things not moving through. It shouldn't have clotting. So what is clotting? Clotting is different than endometrial tissue. So if it's just uterine lining, okay, kind of like stringy like a worm, that's okay. That's within the norm. Clotting is going to be more like a scab. It can range from like dime size to $50. So the bigger they are, and the more you get, actually the worse it is. That needs to be flushed so everything is running smoothly in a woman's reproductive system. So all of that is accomplishable. So the question becomes how? Well, there are many factors that affect a woman's menstruation. For example, have you ever noticed you had a very stressful time and then your period was irregular, or maybe even skipped, or maybe it came early? Stress affects menstruation, but it also affects other measurables like cortisol. Of course, we need to think primarily about your sex hormones because those affect menstruation. And oftentimes women don't check those things. They don't know. Doctors don't actually take the time to look. Inflammation can affect menstruation. There are a wide range of things that can affect menstruation. Nutrition, for example, iron levels, etc. So we often like to talk about finding out the causes so we know exactly why you're having a hard time. One of the really interesting treatments that we have for menstrual issues is really quite amazing, honestly, is a Chinese herbal process. Herbs can do amazing things for menstruation. Help with PMS, lengthen the menses, shorten the menses, work through clotting, regulate the menses. And it doesn't take months and months and months and months to kick in. It's not like that. It's often much faster than you think. So it's a very unique thing that we can do for women who are having a difficult time when the standard of care options are really often unsatisfactory. What are your options? You got birth control. You can go take your pain pill because you got cramps. Or then it kind of ramps up to where we're talking about hysterectomy. When we don't know, let's just yank it all out, right? So it'd be nice to have some non-invasive options outside of those three, and there are many more than you know. So what I'm saying is if your menses is off, okay, then causes can be determined and treatments that kick in sooner as opposed to later that can save radical therapies like hysterectomies from being overperformed are out there. So if you need some help with those things, you go ahead, think about us, give us a call. We'd be happy to talk to you. Thank you very much.